Welcome to Ask a Pharmacist, brought to you by Community First Pharmacy. As the second nonprofit pharmacy in the nation, we put your healthcare needs first. What are the best practices for managing my type 2 diabetes?
The best thing I can tell you, whether we're talking about managing type 2 diabetes, type 1 diabetes, pre-diabetes, is to make sure you understand your goals. Your goals are going to be different than the next person that you know with diabetes. So by goals, we want to talk about our caloric intake, make sure that we're taking in the proper amount of carbohydrates, fats, protein, and getting plenty of fiber. The other part of this is to make sure that our blood sugar goals are understood. So what our blood sugars should be in the morning when we wake up is different than what our blood sugar goals are a couple of hours after we eat a meal. So it's important that you understand your goals. It's important that you test randomly through the day to understand how your blood sugar varies through the day, how your blood sugar varies after you eat a meal versus if you take insulin or if you take your oral medications, and how your medications affect your blood sugars are very important. In addition to blood sugar, one of the most important things we can do as a diabetic is to make sure that our cholesterol levels and our blood pressure levels are under control. In a diabetic, you're managing your blood pressure and your cholesterol levels are much more important than managing your blood glucose levels. Those problems can actually cause death if we don't manage them and monitor them appropriately. Managing your blood sugar levels primarily affect the quality of your life, and so the blood sugar levels will affect long-term consequences and long-term side effects. They can affect your eyesight, they can affect your kidneys, they can affect your nerves, and as a result you can lose sensation in your fingers and toes, and those are things that should be monitored regularly as well. All diabetics should be doing routine foot exams. They should be making sure that they inspect their toes to make sure that there are no cuts or cracks or any open wounds or sores, and to make sure that they aren't too dry, that they moisturize their feet and hands as well. A diabetic, as they age, will end up with very dry hands and feet, and so it's important to keep them from drying and cracking. So make sure we get full fundal eye exams. So make sure that your eye exams, they dilate your eyes and look deep into your eyes to look for any type of eye damage, and make sure we're monitoring our foot care as well. It's very important. At the pharmacy, we have meters to help check your blood sugars. We have the strips as well. Oftentimes they go through your insurance and we can pay for them. Many Part D plans require you to use a mail order pharmacy to get those, and that's something that's changed just recently. So, but we do have them here in stock if you want to pay cash for them, or if your insurance does pay for them, we do supply those. We have many information leaflets on diabetes. So we can help you with carb counting, we can help you with different diets. We have some calendars, we have some different things to help you, like little journals so you can monitor your blood sugars and write them down. In addition to that, we also have monofilaments, which oftentimes isn't discussed. And a monofilament is something that you can use to manage if you have any nerve damage in your feet and toes. And we have monofilaments, and it's very self-explanatory on how to use them, but we can explain to you how to use and test for what we call diabetic peripheral neuropathy. We have those monofilaments.
Find out how Community First Pharmacy can meet your health and budget needs. Learn more by calling 513-645-5447 or visit www.community-firstrx.org.